Hello friends, I am Dr. Rahul Patil, consultant cardiologist, Ruby Hall Clinic, Pune. Practicing as an interventional cardiologist, doing angioplasties and bypass surgeries, after the procedure, most of the patients ask me how should they live their life after angioplasty or bypass surgery. So I thought for every patient, we have to give almost half to 1 hour to discuss about their daily routine after the procedure. So I thought let's take the advantage of technology and make a small video. So I thought making a video in 3 parts. Part 1 will be post-angioplasty diet and lifestyle. Part 2 will be medications, and part 3 will be further investigations to prevent future heart events. So in this part 1, I am going to talk on your lifestyle and food and diet. After angioplasty or a bypass surgery, you need to know from your treating doctor what is your heart pumping capacity. That is defined as ejection fraction or EF on echocardiography report, and normally this report says the numbers in percentage. EF more than 55% is normal, EF between 40 to 50 is mild heart dysfunction, 30 to 40 is moderate heart dysfunction, and less than 30 is severe heart dysfunction, and less than 20 is very severe heart dysfunction where the risk of deaths are very high. So when you talk about lifestyle, exercise, patients with very severe and severe heart dysfunction are recommended to take rest after the procedure for 15 days to 1 month. They can only do their household activities, going to washrooms, toilets, having their own food, and walking around the house or inside the house. Those patients with moderate dysfunction where EF is 30 to 40, they can walk around the house but should not go beyond that, and should limit your walking to 25 to 30 minutes. Those people where pumping capacity or EF is more than 40, they can go for a long distance walk for 25 to 30 minutes or 45 minutes after 10 to 15 days of procedure. But their pace of walking should be slow and normal. Those patients with normal heart function, they can start their routine life after 10 days of procedure. The most important precaution should be they should avoid heavy lifting, pushing heavy objects or pulling heavy objects, because we have seen patients doing that can cause blood clot in their arteries and re-heart attacks. Now talking about further exercises after 1 month. So 1 month should be your first follow-up with your doctor. He reassess your heart function because he expects that heart function should improve after angioplasty and bypass surgery. But it totally depends on the damage to the heart. If the damage is permanent and long-standing, then you may be a slow recovery person. So if your heart pumping has improved, he will suggest you further exercises, and that you should obey to your doctor and follow your doctor. Now let us talk about physical sexual relations after heart attack. I believe most of the people can restart their physical sexual relations probably after 3 months if their heart function is normal, if they do a good amount of treadmill test which is observed by your cardiologist, and he is the person who can advise to you on that. Talking about your exercise, now let's focus on diet. First 15 days, I would suggest you to have a soft liquid diet, lots of fibers, should be less of spice and less of oil and less of salt. If possible, have a boiled food. You are already on many medications, and eating spicy food or heavy meals can add on acidity to it, and this is the time where you cannot stop medicines. So better to avoid acidity, nausea and vomiting, because doctor feel absolutely insecure if you stop your medicine after angioplasty, because there is high chance of blood clotting after angioplasty. These are the first 3 months to 6 months period of angioplasty where the stent which is been inserted in your heart or balloon dilatation where it is done, the healing process gets completed. And this is the time when if you stop your medicines, there are high chances of blood clotting inside and re-heart attack or a second heart attack. So without your doctor's consultation, do not stop your medication. Then after 15 days, you can shift on a regular food, but again with less spice and less oil and less salt. My personal experience with my patients is if you really work hard for first 3 months to 1 year during your maximum healing period, then that is a time when you should not eat spicy and heavy meals. For vegetarians, I would recommend you should have 40 to 50% of protein in your diet, which will be in the form of sprouts, seeds and nuts. soya bean and paneer. For carbohydrate around 20% and fat around 20%. And you try to balance it. Drinking water depends on your heart function. If your heart function says very poor heart function, 20% or 30%, limit your liquid intake to 1.5 liters. If your heart function is normal, you can have adequate liquids and waters. And regular follow-up with your doctor will suggest you change in your diet, and he can bring you to the normal lifestyle maybe after 3 months or 6 months. To know more about your lifestyle and diet, you can consult me at my clinic and visit. Thank you.